So this is part of the Ask Me Anything series about COVID. I'm here with Kier, professor of pharmacy and PhD in epidemiology. Karen, we have a question about the current stance of other pertinent organizations about mask wearing. So what does the CDC and OSHA believe and state about mask wearing, and how do they differ in relation to each other and to the health orders from the state? So I think this person would like to know, what does OSHA have to say? What does CDC have to say? What does the state have to say? And how similar or different are they from each other?
That's another great question. Actually, there is a pretty significant difference, but it has to do with when you look at each individual body. So CDC they have mask wearing is important, and that it needs to be done to reduce the spread and transmission, and that masks are effective. And so the CDC is looking, they are very much into how it's transmitted, the health of the individual, how to protect the country, those type of things. OSHA, on the other hand, is very much as a workplace. What do we need to do within the workplace? So if I am the CEO of a company, their guidance comes out and it says, here as a CEO, these are the things that you need to do to protect your workers. So it's a little bit different. They're not looking at it from a disease standpoint or a transmission standpoint or a public health standpoint like the CDC. They're saying, if you're the CEO, you need to have a workplace plan in place. You need to have preparedness and response plan. You need to have a plan if a worker's sick. You need to put into place things that provide flexibility to allow people to work at home if at all possible. When people are at work, you need to make sure that they're not using each other's equipment or phones or desks, that you have disinfecting policies. You need to make sure that people are at least 6 feet apart and are protected. So that could be the things like acrylic. So the plan would allow each company to make determinations on the safest way for their employees. So that could include things of masks. It could include things like face shields. It could include the acrylic. It could include things like social distancing and keeping at least 6 feet apart. So OSHA is more concerned with making sure that the workplace is safe. And there's lots of ways. So one of the things that OSHA has put out a COVID-19 guidance for employers. And one of the things that they do cite in that is always, as an employer, be checking what the current CDC recommendations are, because you need to be following those recommendations. So although the CDC and OSHA have two different perspectives, they're still working for the common good of protecting the public and protecting the employee. And that could involve many different things that would keep people safe. Versus the state mandates looking at what's going on in their current state, how many cases are there, how's the transmission and spread, maybe by county, maybe by city, and they're implementing, also looking at CDC guidelines, but they're implementing what they think they need to do to protect the public within their state. So states can regulate very different things based on what's happening in their state. So that could be something like where Ohio says, if you're from these states, we don't want you traveling into Ohio. Or if you're in another country, you can't, if you're from the US, you can't travel into our country. So they're looking more at just state guidelines. So there's a common thread, but they're also very different viewpoints. So of course their recommendations are going to be slightly different because of their particular viewpoint.
Okay. Complicated, but the underlying goal is to stop the spread and transmission and to keep a group of people safe.
Right, each from a different perspective. So the CDC is going to be your looking at the disease, public health issues, and that where each state and the employer is going to look at how can they keep their individual state or their individual work environment safe.
Okay, thank you.